So I would like to introduce you to my very good friend, Alison Brown, all the way from Cornwall in southwest England. And so maybe you should just begin by introducing yourself. Tell us what you're doing at the moment, and where Cornwall is as well, bearing in mind a lot of our viewers aren't based in UK.
Well, it's not Cornwall in the States, because you have to be very careful with that one. But we are in the southwest Cornwall corner of the UK. It's almost the boot sticking out into the sea before you hit Ireland, really. That's the best way of describing us. Quite a mild, temperate area, quite tropical. Big holiday destination. Gets quite busy in the summer. Yeah, it's beautiful. I didn't start off here. I started off in the southeast, which is where I was brought up. It's where I nursed, trained at Guy's about 28, 29 years ago now. And at the moment, I currently work in general practice as well as at Peninsula Dental School in Plymouth, which is in Devon. And I walk the clinic with the year 2 dental students. That's where I'm up to at the moment.
Fantastic. So you maybe explain to people, Guy's is where you trained?
In London, yeah. So I was Guy's, which in actual fact, the name Guy's, as though Guy's Hospital is still there, you are now United Medical and Dental Services, I think, which is Guy's, King's and St Thomas's. So yeah, I was at the day known as one of the Guy's girls. Wasn't very many fellas that trained with us. There was one or two, but yeah, we're a unique breed now.
So where were your first days in clinical practice, Alison?
Where were they? Did you say where? Yeah.
Where did you start?
So my first days in practice were back in East Sussex. I did a mixed bag of NHS, National Health Service, and private. Always wanted to go into teaching, never had the confidence to go into teaching, and then you get consumed by practice and learning your craft, and always been involved with the BSc, with the Hygiene Association as it was then, and then I got married, then I had family, and that took over. Still always very involved with hygiene and the Hygiene Association. And then when my children were 4 and 8, I got an opportunity to come and work down in Cornwall. And interestingly enough, because there are not lots of hygienists down here, there's always lots of jobs, or there were, the Peninsula Dental School had opened by then, and they were looking for people to supervise with the dental students. And so that's how I started to do a little bit of teaching on clinic with the students. Wanted to then always progress some further, and I always, when I was training, although I was trained to diploma level, we were always told we'd been trained to degree level, but there were no degrees for hygienists.
Yeah, I'll just explain. So a diploma in America will be an associate's degree. Right.
Okay. So and then, but by then, therapists could only work within the hospital. But by then, the actual qualification had started to change from hygienist to hygiene therapy, and it was becoming a degree program. And I started to think about, I wanted to upgrade my, for me, for future-proofing myself, really, was a challenge for me, which I did with O'Hare, did very well at.
So let's just talk about that. So when did you begin your bachelor's with O'Hare University? When did you start?
That would have been 2019.
Okay.
Leading into, so I would have been 49 when I actually went to it. So, and as you know from doing my mentorship with you as well, education, I've just done education the whole way along, and I'm not very good at being ageist, but I know there are a few out there a bit ageist, and certainly when you start getting into the academic world. So I've never been ageist, but it was the right time and the right place for me, because I had the time to do it, and I knew what I wanted to do, and things have changed. There's a lot more opportunities out there now. because there's also master's degrees, as we understand, and there's also using what we've got, and suddenly you realise doors open, doors maybe that you didn't even anticipate would open.
Sure.
So yeah, that was 2019. Completed that.
So when you started that, how did Alison change in those 6 months between beginning our bachelor's and then finishing?
That actually, I realised that I knew a lot more than I realised I knew. I probably knew where I wanted to go, but suppressed it a lot. I had to learn to shout about myself a little bit more, not hugely, but a little bit. Doing that action research project has just opened doors, and I've gone in directions I never even imagined that I would go into. Certainly.
So tell people a little bit about your project then.
So my project was looking at oral cancer self-screening. It wasn't even something that I'd even considered looking at. I always supported, we have Oral Cancer Month for November in the UK. And I've often done little bits to support that, had all the posters up, spoke to the patients. And we had, this year, we pushed it a little bit more, and we had the local radio station came in, and they and I don't know, there was something about it. Suddenly, as I read into it, the figures weren't getting any better. But we as in dentistry, we're not really helping the cause. We don't actually. We sit there and talk about toothbrushing, and patients have to take ownership of their disease, but they don't do it with oral cancer. It's like you come in, they're not even telling patients that they're having an oral cancer screening. Or if they know they're having an oral cancer screening, they don't know when they leave the surgery what they're looking for either. So I got slightly kind of irritated with myself as much as anything, because I was equally to blame. I was, and I don't understand, I still don't quite understand. And it's something, that's another topic that I'll go look at in more detail at another time. But so my topic was...
Can I just stop you there? What I'm hearing you saying is that hygienists and dentists are screening for oral cancer, but they're not communicating that to their patients, and being, in your experience, really being more transparent in exactly what's going on.
Exactly that. And the Oral Cancer Foundation, the Mouth Cancer Foundation here, are very much, self-screening. And particularly over the COVID, because we've had situations where patients haven't been able to come into practice, etc. And there's about 50% that don't go to practice regularly either. We could be in a whole mess at some point, because, and it's also this is an interesting one over COVID, and this is a presentation I had to give at the university, have we educated the patient wrongly, maybe wrongly, in what they determine, or what even we determine as a dental emergency? Because if you've had a lesion in your mouth for more than 2 or 3 weeks and it's not going away, is that equally an emergency as much as if you've got toothache? And actually, you could say that is. And again, just all these things are just ongoing, aren't they? You're learning as you go. So,
yeah. So when you finish it, sorry to interrupt you. When you did your paper on that,
yeah,
you graduated.
Yep.
Congratulations. And then you submitted your paper to Dental Health.
Yes.
And it was published.
It was published, yeah.
Congratulations. So I bet there's an outcome you didn't expect you would get.
Never thought that would get published.
And then didn't you become an expert within your hospital, your university hospital, on the topic?
Yeah, we from that, so from doing that action research project with my patients, looking at if I showed them how to self-screen, would they self-screen? And they all did. One chap, even still to this day, has what he's got to be looking for in his bathroom cabinet. The patients are more than willing to be screened. and they're happy. And if you want to tell them what they're looking for, and they are happy to do it. So it's not that the patient doesn't want to know, and they all look at it as the same as breast awareness and testicular cancer checking themselves. So we can really quite happily jump on the coattails of everything that's gone before. So there isn't a problem. It's just how we're going to bring it into practice, and we'll get there. So from that, I gave my research. I thought, oh, you know, I'm just going to show them what I've done at the university. So I gave my research to them, and one of them came back and said, oh, could I give you this email? You might be able to go and help with the oncology department when they do their open days, which has never come to fruition actually being on with them because of COVID came in. However, this last November, one of the oral health educators who was struggling to get kind of some advertisements for the oral cancer said, I said, look, don't worry about it. Let me just ask somebody if there's something else we can do. And via the university and a new project that they've set up, I've helped them do some training for open reach clinics, whereby oral health educators will go and teach patients or people that just walking off the street how to do self-screening. The undergraduates also had the whole month of teaching the patients that came in self-screening. Another very interesting one off the back of that is talking to the Oral Cancer Foundation that they'd never thought of targeting undergraduates. They look at dentists, they look at hygienists, they look at therapists, they look at doctors and GPs having all the information and going to patients. They don't tackle undergraduates. Do we tackle undergraduates so that they get into the habit for when? Because the other flip of this that you have to think of is you teach somebody self-screening, you then need to start adding into your dental and social history questions. Have you looked in your mouth recently? And that's another thing that you need to maybe be looking at.
So I guess that all kind of pales into significance compared to toothbrushing. It's one end of the spectrum to the other, isn't it? Toothbrushing is a minor issue compared to self-screening.
Because I haven't really noticed any patients dying from decay or a lack of toothbrushing.
Not anymore.
Not anymore. So I never anticipated going down that subject. I've thoroughly enjoyed it. Is it that I've been frightened of going near the subject after nursing my dad through cancer? Maybe I'm a little bit, I can talk about those things a little bit more easily. It could be that, it could be an age thing. And that may be the barrier with some. And I've also lived through the age when dentists have not wanted us to screen, even though we've been perfectly capable of screening. And I actually had that said to me, I don't want you to screen.
Wow.
So, you know, so things are changing. Thank goodness. So off of that, I then put my lovely friend Linda, who I worked out, who put me forward for the Dentistry Awards.
So this is Linda Douglas, one of our faculty based in Ontario in Canada.
Yeah, and I did my degree with Linda. So I thought, I'll take the baton then. I put in, it was all of this that I put in from the Oral Health Awards. But it was a very strange situation, because if you put yourself in for the Oral Health Awards, they can also put you into other groups without you necessarily knowing. So although I didn't win Hygienist of the Year for the Oral Health Awards, I did win on that Hygienist of the Year for the Private Dentistry Awards.
Wow.
And that was all on the work for oral cancer self-screening. Yeah.
That's fantastic. So where's that award? That should be that
is a pride of place. It's at work, displayed on the reception desk.
Fantastic.
And yeah, so that they all see what's been going on. So yeah, it's so quite literally. I did put on Trish's post the other day when she said about going to do the degree. You just don't know what you're going to in those 6 months. You will be surprised the journey you'll go on, and where that journey doesn't stop. Once you've graduated, the journey just keeps moving on.
It's great advice for anybody who's thinking about studying anything.
Yeah, and do you know, also sometimes our careers is always, what do you want to do, where do you want to go, what's your ambition? And we've all had it, and that's the right thing to do. But for once in my life, I'm actually doing things and thinking, right, let's see where this takes me, because it may take me somewhere where I'm not controlling where I'm going. Because as good as that is, sometimes maybe you need to be taken on that journey.
It's not more good advice. So how you didn't have to hang around too long between finishing your bachelor's before you decided to apply for a master's degree?
No, I didn't. I just, as I finished that, I contacted Jeannie at the Eastman, and I went. What did I do? I phoned her, and she said to me to apply. And yeah, I finished with you in must have been the March time. We were just coming into all the COVID lockdowns, so it must have been March, April time, and I started with the Eastman in the September.
Wow. And you start, I think you're kind of like putting yourself down a bit. You were accepted to do a master's degree at the University College London, which is in the top 10 universities in the world. So big up for you. Well done.
And another good thing that your graduates need to understand is that degree is accepted by them. I know some people get very worried about, will that be accepted, etc. And it is accepted. And I was asked for it, and Tricia was asked to give the information about it, and it accepted. So you can use that regardless of what some things may be said by others. People recognise it, and it was fantastic. So yeah, I mean, I'm now halfway through, so I'm 18 months in.
So what would you say is your biggest learning moment so far, doing halfway through your master's?
Is enjoy it. Is actually.
What about your takeaway? Your takeaway yourself.
What from the masters is, we don't give ourselves enough credit for what we know already. And I think we can stand head held high alongside our dental colleagues. And I'm talking about maybe when you start looking towards the more specialist dental colleagues, and they have respect for you, and for doing that masters, and how much detail you do know. But what it has done, it has made me finesse things. Maybe where some things were a bit rough around the edges, it's made me finesse things. It's made me be able to show things, talk through things. My written, all the way through writing when I was doing my degree program with you, it was like, God, I hate writing this. I hate doing, referencing. I still hate referencing, but writing does get easier. And the way you think changes, and the way I approach things has changed.
Would you say that you're more considered in your approach and more thoughtful about how you write, and more detailed in how you write?
Well, it's more detailed. Yeah, it's just building blocks. As all teaching, it's just building blocks. You gain one thing, and then you just build on that, and you just build on that. But it is hard work, and but I've still managed to work alongside it, and I've enjoyed it. And it really has changed the way I think how I approach my patients and what I'm doing. And that's not just in health behaviour change, it's also, you know, clinically. And I've got 30 odd years experience of, you know, nearly 30 years experience of actual physical clinical treatment. But even on top of that, I've learned. It says something.
So you start your final year in the autumn this year.
This year.
So you'll be graduating 2023, all going well.
Mm-hmm. Yeah.
Good. So what will Alison be doing then? What would you like to be doing after you graduated?
I think I would like to be confident enough to maybe do some of my own teaching, have maybe some of my own teaching I want to go forward with. I would like to use this master's to maybe teach with postgraduate as opposed to undergraduate.
Mm-hmm. Yep.
And I'm just and I just want to hope I can do that final year and enjoy it as much as though it's hard work. I do enjoy it.
What about PhD?
Oh, I don't know. I don't think. I suppose you can't ever say never, but I don't know. I'd need to be more academic. I'd have to be in a more academic setting, I think.
Have you found a particular topic while studying your masters that really kind of like holds your interest more than others?
Behaviour change. Because teaching the undergraduates, I really realise how much I was never taught health behaviour change. It was never spoken about, was it? You know, in motivational interview, etc. But having done so much health behaviour change with your course, with your programme, and then taking it to the next level with the masters, I find it quite fascinating. But I also realise that actually all those hours of sitting there with a toothbrush with this patient, actually, maybe I'm doing it wrong, but actually I do less picking up the toothbrush and showing them and do more talking and actually finding their reasons for wanting to change, as opposed to me inflicting my reasons why I want them to change. It's a different
topic.
But it's fascinating.
Yeah.
I find it quite and frustrating and a challenge, because I quite often don't always get it quite right, and so it's just something. So that, yes, I have always enjoyed that, but I didn't realise how much I was going to enjoy it once I moved on with it as well.
Yeah.
And also some of the leadership. The master's course takes you on a leadership module as well, and there's parts of that I quite like. Like, could I use that qualification in leading oral health promotion within a community setting? That kind of thing.
Well, the answer to that question is yes, you can, because you can do anything you want to do.
Yeah, absolutely. And that's why I kind of say to you, maybe I need to the journey to just take me, because I was surprised when I finished my degree program that the doors that opened. Let's see. That's how I'm looking at it.
Cool.
I don't want to make any hard and fast rules, because sometimes that boxes you in. I'm trying to be brave about it, Tim. That's what I'm looking at.
I like your philosophy. So one final note, if you were going to give anybody any advice on somebody that was procrastinating in making that step into embarking on another bit of education in their life, what would you say?
I would say the hardest part is that little step. It's because the things you'll worry about could be, am I too old? Will I be able to keep up? I haven't learnt for ages. Will my brain be able to cope with it? I can't write. I can't, because they're all the things that I went through. But it's done that the program that you run is done in such a gentle way, bringing people forward, that it just slowly the brain wakes up. And you know, it wakes up, it works. And look at me, I'm doing a master's with people who are in their 30s and I'm 51. I'm like the old, we've just been asked to put a presentation together for undergraduate hygiene therapists to talk about your career and where you're going. And I actually had to say, can I go first? Because I said, I've got a lot more history of what, and then I said, you lot can take off from where I finish off. But, you know, just be brave and just go for it and be open to where it can take you, because you'll learn a lot about yourself as much as you'll learn you know, some new, yeah, and you'll gain new, you know, new colleagues. And yeah, I would just say be brave and go for it. You'll never look back.
That's fantastic. Thank you very much, Alison. So thank you for your time today. Really appreciate it.